The TJC Dental Hygiene Sterilization process. When receiving dirty instruments, you want to make sure that you're receiving them on the dirty side of the window. Wear proper PPE, your lab jacket, utility gloves, and always take the dirty instruments from the dirty side of the sterilization window. If somebody is putting something dirty on the clean side, make sure you speak up, disinfect the area, and ensure that it is being placed on the dirty side. You are the eyes and ears of your patients, and we want to make sure we are not cross-contaminating anything. As a CA, it's your duty to keep sterilization bags stocked on the counter for students to grab and the pencil sharpened. From the window, move those dirty instruments into red bins and move it to the dirty side of the aisle. Here you can see I have received some dirty instruments. The red bin is dirty and on the other side is clean. We're going to take those dirty instruments and we're moving it over to the island where the other dirty instruments are. The next step is putting instruments and their cassettes into the Miele. We use a disinfection vario throughout the day. It's a wash cycle that removes debris from the dirty instruments. You only use 3/4 the cup of the detergent. Always make sure you put the cup back into the bucket and shut the lid behind you. You want to always ensure that the recharge and neutralizer lights are not flashing. If they are, just notify your professor. There also is a rinse cycle. This is for the end of the day rinse. It'll be a 5-minute rinse, and it's for the last bunch of dirty instruments so that the dirty instruments aren't just sitting there with debris on them with it drying on it. So the next day when the next CA comes into the clinic, they'll see that the Miele was left on a rinse cycle, and they'll automatically know that it needs to go through a disinfection. So you're going to stack them into the Miele in order, and you'll put the sterilization bags in order, stacked neatly on the counter. Here I am putting 2/3 a cup of detergent into the Miele. As you can see, you don't want a heaping cup full, just enough. Putting it back where we found it. And now we're going to make sure the door is sealed, turn the machine on, and you can see there that it is flashing recharge. We'll have that taken care of by notifying our professor, but you can see there the disinfection vario in which the dial is on. That is the rinse cycle that we would put it on. You can see I turned it over to a rinse cycle. That is the 5-minute rinse cycle for the end of the day. An alternative to the Miele is an ultrasonic cleaner. We do have two in the clinic, a larger one and a smaller one. Of course, you're going to use your proper PPE, and you will just fill this with water from the sink. Distilled water is not necessary for this. You want to make sure that the clamp is shut to ensure that the water will fill up when you're filling it up. And you're going to fill the water high enough to cover the instruments that you're putting into the ultrasonic. You'll use enzyme cleaner in the water. 2 pumps is suffice, and you'll run the cycle for 15 minutes. This is going to use ultrasonic vibrations to remove debris from any instruments. We also can use this for cleaning dentures and partials in the clinic. You'll just put it into a Ziploc baggie with some tartar and stain remover, and at the end of the day, we just open the latch, let it drain out, rinse the inside, and just dry it out with paper towel. Here is the large and small ultrasonic cleaners in the sterilization room. Of course, it's our alternative to the Miele. It is a quicker option. So there I'm showing you that the lid comes off. You'll fill it with water, put the instruments in, and start for 15 minutes. Over on the side, you can see this is where you would flip it up and allow water to drain out, and you just shut it back to ensure that it's going to hold water and not drain off into the sink. If you don't check that it is completely sealed, it could run out into the sink and burn up the ultrasonic if it is running. After removing loose debris from the instruments, whether using the Miele or the ultrasonic cleaner, our next step is moving into the autoclave sterilization. This is actually the sterilization process. Whenever the autoclaves are dirty, you're going to want to make sure you're wearing your lab jacket, utility gloves. Inspect the unit before use. Distilled water is the only type of water that should be going into an autoclave. You want to make sure it's filled into the green area, that there's no loose debris like ripped paper off of the bags in the autoclave. Make sure it looks nice and that the gasket is flush and sealed. Make sure that when you're filling the autoclave that you're putting the plastic up and that you're not putting any kind of plastic on the bottom shelf or directly on the edge, as it can melt the plastics. Also, do not overfill the unit. Make sure that the bags aren't stacked on top of each other. The point is to sterilize them, and if it's overly filled, it could block some of the space and prevent the sterilization process. Since we are putting our instruments in pouches, you will see that I am going to be using the pouches cycle, and I'll push start to start it. Let me show you that now. So here I am wearing my utility gloves and lab jacket, and I have my plastic up. I'm going to load my trays into the autoclave. So I have plastic on one and a metal container on the bottom. So as you see, I'm putting the metal on the bottom and the plastic items up top. You can also put them on the middle shelves. I have previously already filled those, and it's not overfilled. Next, you can see that I am checking the water level. You can see the red and the green, and we're making sure that the distilled water is filled into the green. Next, I'm going to check the gasket, making sure that it is flush. And we're going to shut the autoclave. And out of our options, since we're in pouches, we hit pouches and start. After starting the unit, you want to make sure that you grab disinfecting wipes and you wipe the outside of the unit. Not just the handle, make sure that you're wiping the entire thing because we're all wearing dirty gloves when we load them and you're not sure exactly what was touched. So just wipe the entire thing down thoroughly. When we are going to unload instruments from the autoclave after they have been sterilized, you want to make sure you have clean hands. So either wash them or use some sanitizer. And we are going to use some mittens because the instruments are going to be hot. And you will take the clean instruments and you're going to move them onto the clean side of the island. After the clean autoclaves have been unloaded and we have sterile instruments, we are going to put them in their designated lockers. We always want to make sure that we are putting them in the proper locker since we all have our own individual ones. The number on the package is the locker number. So for example, this would be locker number 50, so we're going to make sure we put it into locker 50. If you can't read what it says, look at the colors, such as this one says purple and white. We're going to look for the bin that says purple and white if we can't read the number. If the bags don't have anything on it, there is a lost and found drawer. Make sure you put it there and notify your classmates that that has been found. Well, I hope this helps. Thank you. Bye.